is that somehow the body starts producing antibodies against the receptors on the thyroid gland. And what it does, it causes the hyperfunctioning of the thyroid gland. And the thyroid gland is responsible for secreting thyroxine hormone, a hormone that drives the metabolism. So when it hyperfunctions, everything gets upregulated. And so this manifests in terms of like different symptoms, right? So if you think about it, you could start from head to toe. The brain, you could become confused, you could become psychotic, and it's one of the reasons why when patients present to you in a psychotic episode, you want to rule out other causes before saying, hey, this person is mad or they're suffering from schizophrenia or something of sort. You can become confused in terms of like the heart. You can get arrhythmias, fatal arrhythmias, which essentially those are abnormal beating of the heart, right? And as I said, those things could be fatal. You could get what we call high output heart failure. Your heart can fail and no longer, and is no longer able to pump blood forward to perfuse the body. You can get palpitations, heart racing, this pounding sensation in the chest. If you think about like the gut now, you could sometimes get nausea, vomiting, and classically you may get in the sense of hyperthyroidism, hyperfunctioning of the bowel, you get hyperdefecation. So every minute you're having these diarrheal episodes, right? In terms of your sensorium, anxiety, you're just jittery, always having this tremor, you're always on edge. You have what we call heat intolerance, where you're in this room, it's air conditioned, and somehow you're feeling hotter than usual. Oh, you're so hot when everybody else is so cold. We call it heat intolerance, right? So those are some of the manifestations of Graves' disease.
It is, because I've known people that have had thyroid issues, but then they don't develop things like the bulging eyes, and so is Graves an extremity of the thyroid issue?
Well, all right. So the thing is, it's interesting that you say that, because patients don't always have all the symptoms.
Okay.
So classically what they have is what we call like a goiter. They have what we call the bulging of the eyes, right, which is an ophthalmopathy, which is just a big word for thyroid disease of the eyes. And so classically, the bulging in the neck, the goiter, the bulging of the eyes, classically, we call it a triad. So the third one is the skin reaction on the legs, where you develop like plaques and hardening, and what we call non-pitting edema, meaning the leg swells, and if you press on it, it should pit, as in heart failure. There's a depression, but in thyroid Graves' disease, it doesn't pit, and so it's classically Graves. So yes, persons don't always have all the symptoms, but classically that's what the triad is. In addition to all that we've said before.
Almost every single disease these days you hear lifestyle. And if you don't eat this, you're going to be fine. And if you eat this, you're in trouble. Does Graves' disease have anything to do with what you eat, how you grow? When your mother was pregnant, it have anything to do with anything like that?
All right. So I guess what you're talking about is like sort of the risk factors.
Yeah.
But I will start with the what you eat. I can't impress upon Jamaicans the importance of diet, lifestyle modification. And I know some persons don't like to hear this, but plant-based diet, and I'm guilty. I eat at this time. I still do eat meat. I'm trying to incorporate more greens and vegetables as we speak. But it was found, and this is evidence-based, that a plant-based diet reduces your risk of a myriad of diseases, including autoimmune diseases like Graves, right? So that's one thing. The other thing is you have, as I said, you have other risk factors. So that's just one thing, the diet, right? Family history. So you made mention if your mom or your sister or your aunt, if they have Graves, it increases your proclivity to develop Graves' disease. So that's one, family history, and a hereditary component. So there are different genes that put you at increased risk of developing Graves' disease. So yes,
Question,
that's some of the risk
can you
factors.
get it at any age? Are you born with it? You can get it at very young. You can get it all like me. Tell me about that.
Again, when it was never in medicine, but classically it's roughly under 40, so between ages 20 to 40 years old, and it's more you'll mostly find Graves in women, right? So
Find Graves in women.
in women, yeah, women are more affected than males, and that's
It's
one of the
something
risk
that you can
factors.
get rid of, or something that you just control.
Well, the thing is, let me not say get rid of, because some persons, when they have Graves, you put them on medication and they go in remission, right? And so you can taper down the medication and then possibly take them off. But it doesn't mean that you'll never get it again, right? But yeah, you can go into remission and then, you know, because it's an autoimmune disorder. So your body knows how to produce.
So it can be
against.
cured. Sorry,
So
so it can be cured.
cured. So it can. I would say it can be managed. I place you on medication. You go into remission. So it goes. But I'm saying that doesn't mean you can't ever have it again, right? Yeah.
It's one of the challenges of identifying Graves and treating Graves is that the symptoms are common to other types of illnesses. So, for example, you know, the rapid or irregular heartbeat could be something else.
Yeah, no, that's
The pain
you're right.
in the eyes could be high blood pressure.
It could be high blood pressure.
Yeah. So is that one of the challenges that people will experience the symptoms, but not know that it's connected to the thyroid or that it is Graves' disease?
Correct. You're correct. And so some persons, as I said before, they may have an upset stomach. They may be passing a lot of stool, and they pass this off as, oh my, it's probably just some gastroenteritis. You know, they may be having palpitations or chest pain and think something different. Oh, it's perhaps a heart attack or something of sort.
Angina?
Am I having angina? Which in cases of very advanced Graves' disease, you can get. Right, it's possible to have chest pain and really bad palpitations. Yeah.
We spoke about Mr. Palmer, was the first person I've heard with Graves' disease. How prevalent is it in Jamaica?
Well, the thing is, in terms of data for Jamaica, we don't have, I've not come across, I was actively looking actually, but I've not seen like solid data to say, hey, what's the prevalence in Jamaica? But we do know it's a very common disease. Worldwide,
very common.
It's common. It's common. As I said, I don't have the statistics, but you see quite a few cases in women, as I said before, and locally, absolutely.
Wow.
Yeah.
Yeah.
Didn't know that.
And you'll see them coming to the endocrine clinic at the university hospital as well.
Yeah. Treatment accessible, expensive?
Treatment is accessible. I wouldn't say it's overly expensive, because one of the things you want to try to do is to abort the symptoms, and we use beta blockers, and which is sort of an antihypertensive medication, but it's reasonably priced, I think. And the antithyroid drugs, the drugs that basically put you back into a normal thyroid state, those aren't overly expensive.
Okay.
Yeah, so I think treatment is accessible and manageable.
Yeah. What's HYC?
HYC means high yield clintegration.
Clintegration.
High yield clintegration, and the clintegration is a fusion between clinical and integration. Essentially saying at HYC Medical, we give you the highest yield care for what you've signed up for, and everything is clinically integrated.
Can I show the reason I asked it?
Absolutely.
Can you stand up and turn your back?
There we go.
Yeah, don't move just yet. Don't move just yet. There you go. No, hold your head down a little bit.
Hold my head down.
There you go.
There you go.
HYC.
All right. May I have a seat?
You may have a seat, even though the interview is over. Good to see you.
All right, thanks so much.
Very, very well explained. Sit with us for a while. Very well explained.